Okay, here we are, people. I'm just here. We're watching the premier address Bermuda. You know what I mean? Because we're COVID-19, so about to go back on restrictions and all that
Thank
shit.
you very much,
It's gonna
Minister Tom.
address. So I'm just gonna give you my little input and what he's
Earlier
saying.
today,
You
the
know what I mean?
Cabinet met to
Okay.
discuss our current circumstances
Okay.
and the Ministry of Health's recommendations for further actions to stop the spread of the coronavirus. The recommendations are founded in a need to stop the spread, permit the vital work of contact tracing to accelerate to isolate positive cases, and allow our healthcare teams to focus on increasing testing
Okay.
and
I hear.
vaccinations. Accordingly, the Cabinet has agreed the following: that Bermuda will be under a stay-at-home order from 5 a.m. on Tuesday, April 13th, for 7 days. This means that persons are not to leave their homes for anything other than essential movement or grocery shopping.
Back on
Grocery
lockdown,
shopping will
7
return to
days.
alphabetized days of shopping by surname.
Shop
Shopping
by
for essentials at
the
a
name of the
pharmacy,
alphabet,
also
the
attending the gas
last
station,
name or some
attending a
shit.
vaccination or testing appointment, or attending a medical appointment at a registered healthcare professional's
Okay.
office. Additionally, there will be limited banking services that will be able to provide. These permitted businesses will operate from 11 a.m. to 7
But let
p.m.
me fast
during
forward a
the
little bit.
7 day period.
Because, like,
Families and to protect our country.
Okay, let me just
To
show you.
ensure that our
See the
hospitals are
link?
able to service
If you
all
want to check
those who
out
need
the
help
full video,
and our brave
that's
healthcare workers on the
the
front
link right
line
there.
can
You
get
know?
some
Because,
relief.
man.
Over the coming
So
days,
now
we
we're
will
just
be in our
listening to the
separate homes.
premier. You could check the full
Despite this
link if
physical
you want.
disconnection, we must come
So,
together with a
we're
collective.
saying we're to come together. We're getting on lockdown. Okay, and then he gets a little deeper towards the end now. You feel me?
Know that it will not be easy, and that I
Okay.
know that many are frustrated, worried, and all
No
indicated. We will be giving another press conference on Tuesday, where we will lay out the next steps, which will take get back to where it needs to be.
Okay.
With that, I'm happy to take questions from members of the media.
Okay, fuck, I went too far.
Conference on Tuesday, where we will lay out the next steps, which will take place after the initial 7 day stay at home order. But the most important thing for all of us to remember is do not mix households. Be very careful and be very vigilant, and follow public health advice. You can contact tracers information. Make sure you quarantine if you're asked to do so, isolate if you're required to do so, and make sure that you do what is necessary to help this country get back to where it needs to be.
Okay.
With that, I'm happy to take questions from members of the media.
Okay.
Community
Here we
by
are.
the end
Watching
of
this
May.
here. Yeah. Now,
Vaccinations
first of
work.
all, I'm watching
They
it.
prevent severe illness
Okay.
and
You
therefore
can see
prevent
that it looks like
hospitalizations.
it's reading. He ain't looking up. It's looking.
As I close,
You know what I mean? Look his eyes.
this
Now he
outbreak
starts.
is far-reaching, and it has affected many.
Physical parts.
You're used to seeing me at these press conferences from the Cabinet office, but there is a reason why I'm joining remotely today, and that is because I recently tested positive for a coronavirus infection.
Oh, fuck.
It was a very low-level positive due to the fact that my immune system can recognize the virus due to the vaccine, and I've had no symptoms whatsoever.
I don't understand that
It
one.
was my 5th test in 3 weeks, and on Good Friday, my entire family tested negative. So it was quite a shock, especially as we've been extra cautious. But it is a shock that has been experienced by many in Bermuda. Thankfully, they have all tested negative again, and they are quarantining while I am isolating from them as required by law. I am fine, and thankfully, because I've been immunized, I have no fear, and I've experienced no symptoms. But it is a reminder to all of us that we cannot be too.
No, that sounds weird to me because like if I was vaccinated, I'd be like, well, I've been vaccinated. You know what I mean? But they keep saying I've been immunized, but they keep listening to him.
Careful, and we should avail ourselves of the testing that is available and make sure that we protect ourselves due to the vaccine that is available. This virus is not a hoax. It is real. It has impacted the world. It has impacted our island. It has impacted families. It has impacted our national psyche. However, there is one thing that it has not impacted, and that is this government's determination to see this country through. Unlike other countries in the world, Bermuda has enough vaccine doses to get this country to herd immunity. And we will use this time to accelerate our vaccination program to ensure that we salvage our peak tourism season and have a regular summer. Just like we set a goal to administer 38,000 vaccine doses
38,000?
by the end of March,
No.
and we met that goal,
65,000
I
in the
have
island.
no doubt that we will meet the goal of her.
So no, with 65,000 people and he's saying 38,000 have been vaccinated. So fuck, we shouldn't be on lockdown. But hey, you know what? Listen, you know what I mean? We should be doing better than doing worse. But we're doing worse and we're about to be locked down again. But here we go.
Herd immunity by the end of
So I guess
May.
the Hill Islands can get
However, we must be vigilant. We must follow the rules. We must recognize that our actions today will be the cause of our future tomorrow. We must all stay at home
so he
and
said
protect ourselves and our families and to protect our
He
country.
said it's been being
To ensure that our
looks like
hospitals
it's
able to
raiding,
service all those who need
a
help
script.
and our brave healthcare workers on the front line can get some relief.
You said telling me you
Over the coming days, we
that
will be in our
got
separate
tested
homes.
and shit. You wrote
Despite
everything
this
down so
physical
you can make sure
disconnection, we must
it was
come
straight.
together with a collective mindset to do what it takes to end this outbreak in this country.
Okay.
I know that it will not be easy, and I know that many are frustrated, worried, and ultimately tired of this persistent battle.
Right, the only reason I think because
this does not
when you
mean
listen
that
to
we
him
have to
in the
agree on
question and
everything.
answer part,
But it
when you listen to him in the question and answer part, he stutters a lot, and in her he ain't stuttering like he's reading from a script. But you know, I guess he put in the script that he caught the coronavirus and shit. I don't know.
does mean that we must work together to achieve our common goal of stopping the spread of the coronavirus and ensuring that we protect our entire healthcare system. As I indicated, we will be giving another press conference on Tuesday, where we will lay out the next steps, which will take place after the initial 7-day stay.
So now, based in your line. Question and then answering. Earl Baston comes
Good evening, everyone. Good evening.
Earl Baston comes in and asks a few questions, so we're gonna hear this shit for a little bit.
With this latest announcement.
Part 2 to my videos. Make sure you like and subscribe. Check on my books, but we're gonna entertain ourselves this shit for a little while.
Made by the government. Will we still have the airport open for people to come and go?
The airport is not being closed.
The airport ain't getting closed, so okay. I don't know.
Fine. And also with this latest announcement, what happens with...
Even if you plan to fly her, if you're on lockdown, I don't even know why, but maybe we'll fly out, get out of lockdown, I don't know.
14 days. We've been coached and processed for everything happening.
Let's go forward.
First 7 days, which would be the stay-at-home order, as the Premier indicated, we will be making further announcements. That you are not allowed to, but more of that we will be announcing later on this week.
Is with this period, will they be allowed to train on the water while we're in?
Talking about it's boating season, see, so his one did not be getting at the sailboat race, but you know what I mean. But the next guy has some good questions too. Hold on, real quick.
Please ask your questions.
So now Don Burgess comes in and listen to this.
Good evening and thank you. Mr. Premier, you just announced that you had received the COVID vaccine.
Yeah, we just watched.
And now that you have COVID, and you've more than...
Let's not go so far as to have COVID, but go ahead.
Okay, well, you tested positive. And how might...
So I guess if you got it, you tested positive, that means you got it. I don't know, but I guess he says yes, but he said he ain't got it. I don't know. Let me know what you think in the comments. Does he have it? Does he don't? But it's a good question. Let's see what he says.
You answer those people who think that this might shake their confidence in getting the vaccine, since you've already had two and your 2 weeks passed?
I would say that it should not affect the confidence at all. The fact that I'm here, the fact that I have no symptoms, the fact while there are many persons that are in hospital or experiencing symptoms who have not had 2 doses of the vaccine and are fully immunized, is a testament to the vaccine's effect.
My thought was if you get the vaccine, you shouldn't even be catching COVID, you know what I mean? But no, they're saying, this is what they're saying.
Goodness. I mean, the vaccine, the initial ratings was 95% effective against mild to serious disease. Dr. I'll quote better the statistics in regards to the vaccines effectiveness when it came to death. But the fact is that I tested positive, a very low level positive infection. As I said, I felt nothing. It was a CT value or CP value, however they say, where most doctors do not believe that you can be infectious. But the fact is that we take the precautions. We're going to wait in Bermuda, and our goal as a country is to accelerate the vaccination program to get us to a place where we have herd immunity. So for myself, I would say that I am an example as the reason why you should make sure that you get vaccinated. So in the off chance that you do get a coronavirus infection, your immune system can recognize it, fight it off very quickly, and you can, do press conference in a Sunday evening from isolation.
No,
Okay, thank you.
what was confusing me was him saying get it so your body could fight it. I thought you get the vaccine, so you didn't have to catch it, but I don't know. You heard it. You look like to tell me what you think. I'm just listening to you. You feel me?
We just heard that there are 36 persons in the hospital with 6 in the
that's fresh,
ICU.
but a little bit annoying.
We have 90 beds.
90 days.
Can you update us on how many breakthrough cases or ICU, or you just said
Oh, right, no.
states can now meet indoors
Okay, well,
and
we're going to pause it and
unmasked
then
with
we're
other
going to find out
vaccinated
last
people as the
one.
risk of transmission. Thank you.
Okay, here we come for another question.
We're learning more and more about breakthrough cases, meaning people who have been fully vaccinated, including 2 weeks past their second shot, who are contracting the virus. CMO at the last press conference on Tuesday reported that Bermuda had 23 breakthrough cases as of March 29th. Can you update us on how many breakthrough cases we've had to date and what is their status?
So you got some breakthrough cases off there, your vaccine, and you still catch the corona. You know what I mean? But this is going to be his answer.
I don't. I don't have the most recent figures yet. As you appreciate, the numbers are coming in quite quickly, so I can get that to you at some stage. But as of last week, we had 30 cases that I was aware of.
So that's 30 days.
Including
What their status was?
That's saying including him.
Sorry?
And their status?
What do you mean? The clinical status?
Hospital or ICU, or you just had?
Oh, right. No. There's nobody who's been fully immunized. That's 2 doses plus 2 weeks who was admitted in hospital.
Mr. Kamir, were you going to add to that?
I was just going to say, when he's counting the people, I would be one. But I think it's important to note that there is the infection, and then there is the disease, which is caused by the infection.
Yeah.
Okay. Thank you.
It's a very important distinction.
The CDC came out last week.
No, the premier, so the guy's saying about 30 people that's been vaccinated that ain't, he said nobody's been back to the hospital. Now the premier is saying he's one of them, so I guess he's trying to get in these stats or whatever. So yeah, we're going to look for another good question.
Important distinction.
The CDC came out last week and said vaccinated people in the United States can now meet indoors and unmasked with other vaccinated people as the risk of transmission is very low. We've heard talk about incentives in Bermuda. Why are vaccinated persons in Bermuda being made to lock down with the folks who have not been vaccinated?
Don, if I can answer that before the CMO gives the technical answer. Certainly, it is a concern that a number of persons have raised, but where we're operating from is we're operating from the place of science. And the CMO has given his advice. There is going to certainly be discussions this upcoming week, because I certainly recognize the concern of those people who have done the right thing and who have fought.
See, they're saying do the right thing, so what's trying to say the vaccination's the right thing? You know what I mean? We're supposed to be fighting the coronavirus and shit, you feel me? So what they're basically saying that if you've been vaccinated or not in Bermuda, you got to be locked down like everybody else. That's what they're saying unless you're an essential worker.
All the rules and are now, at a place where they need to remain home while they've done everything right for those persons who may not have done things correctly. And then we see the situation that is at the hospital. But it is a discussion that we will have, but we're going to make sure that we make the decisions of which we have balancing all the available factors and all the available facts. CMO, don't know if you want to add a technical matter to it.
Well, thanks, John. So the best way to
Yeah,
answer that
he tries
question
to
is that
explain
for
it.
fully vaccinated people, I am, yes. For fully vaccinated people, the reason why you need to quarantine is not primarily for yourself, it's to protect people, less more vulnerable people who are not yet vaccinated. And there's a lot of that on Ireland, and the example of that is the number of people who are going into hospital that Dr. Miller talked about earlier on. We are conversant with the advice from CDC. We have looked at the backing data to that and compared that with what other jurisdictions are doing. It's noteworthy that it's only the CDC that's given that advice at this point in time. We believe that we will be getting to that stage when we have a significant proportion of our vulnerable population and we are as close as possible to herd immunity as a country. So those restrictions will be lifted at some stage. It's just at this point in time, we're appealing to all the altruistic nature of Bermudans that this is not just for them, this is for protecting the whole country.
Okay, thank you. Mr. Premier, the government has been.
So they're saying get your vaccination and just be locked down and be quiet. That's what they're saying. Hold on. We're going to find the final questions.
Okay, thank you. Mr. Premier, the government has been promised.
Okay, now it's going to ask a question about the people that caught out of curfew and shit. Like they're trying to bring everybody to the fucking courts and shit, you feel me? So then we get caught slipping, then we breaking curfew.
Seeing that this past week, several people would be in court for COVID violations, and yet there was just one prosecution, which was for a curfew offense rather than a party. We now have 4 dead Bermudians in the last 7 days. Many of the public have lamented they are obeying the rules and are having to pay the penalty for rule breakers by being yoked to tighter rules. When are those who are hosting illegal parties going to appear in court?
Don, I share the frustration. I understand the frustration. The frustration is real. And it is a topic of conversation, which I will raise with Her Excellency, the Governor. As you would.
Basically, he just says it's just gotta wait for the prosecution to take people court and shit. But looking, they're just begging to get people in trouble for, being outside or whatever the fuck they call it, whatever law they say are breaking. But yeah, one sec. Okay, here we go to our final question by Trevor Lindsay. It don't play. Let's see what it's gonna say.
To ask you what constitutes, as you stated, low contact. Excuse my expression, but you can't tell a woman she's had pregnancy, she's either pregnant or she's not pregnant. So what constitutes low contact? You either have the virus or you don't.
Trevor, I contracted a coronavirus infection. It was a low-level positive. I'll leave it up to the scientists to give all the definitions between CT values and what that means and how that factors into it. But the fact is that I contracted a coronavirus infection. I am in isolation and following the rules of which are necessary under the laws of the Quarantine Act, as directed by the Chief Medical Officer of the country.
Okay.
But yeah, I don't know what that meant. But yeah, that pretty much concludes our question and answer. And you could check the full video on that link up there, up in the box, how they say it. No, it's on the TV box. But yeah, check the link and shit, like and subscribe to my videos. Until next time, stay up. Okay, here we are.
What?
Trevor Lindsay asks us the premier question. Let's see how much times he says in these next few minutes. You know what I mean? This the premier of Bermuda, the leader of this shit, you feel me? But I ain't saying nothing, I'm just saying, let's listen. If you could count how much, you could probably win the prize.
As you stated, low Where's the two? No contact. Excuse my expression, but you can't tell a woman she's had pregnant, she's either pregnant or she's not pregnant. So what constitutes low contact? You either have the virus or you don't.
Sorry, Trevor. I contracted a coronavirus infection. It was a low-level positive. I'll leave it up to the scientists to give all the definitions into CT values and what that means and how that factors into it. But the fact is that I contracted a coronavirus infection. I am in isolation and following the rules of which are necessary under the laws of the Quarantine Act, as directed by the Chief Health Officer of the country.
Okay, 4 wasn't too bad at that time. Let's see.
Another
Let's
question here,
one.
what
About
happens to
4.
businesses with containers on the docks, being shut down for 7 days? First 7 days, I'll put it that way, and you're due to have meetings to either extend to see where we're gonna go with this.
I would say that containers of the docks are essential services as defined under the Essential Services Act, and those containers will be able to be cleared off the docks. Whether or not they'll be able to be unloaded is a different question. But food supply, refrigerated containers, and those things will be able to continue as they were last year. What I would like to say, Trevor, is to provide a little bit of clarity. The government of Bermuda has prepared a number of various graphics which will be going out to remind people of the restrictions that are in place. But what I would ask people to do is just harken their minds back to a year ago when we were in a similar situation. And what that meant is that, you're allowed to leave your house for an hour for exercise. You were restricted to your home, outside grocery shopping, those type of things. This is a very serious situation. We are acting to protect the hospital. And that is what we must do, protect the hospital.
Protect the hospital.
I haven't heard anything about those that are homeless, and I got a few calls about family members of homeless individuals. What happens with the homeless in this situation?
Thank you, Trevor. It's a good question. As you can understand, there was a discussion that was held at Cabinet earlier on this specific issue. Last year, during shelter in place, we did provide services to the unsheltered population. But given the transmissibility of this virus, it would be unwise to put a person in a place, even if they are socially distanced as they were last year, due to the challenges of which we are experiencing. The Minister of Social Development and Seniors will be speaking to precisely what services are going to be provided to the unsheltered population. But the one thing which we're going to make sure to do is to make sure that there is going to be testing that is going to be available to ensure that there are no outbreaks there as well. Continue testing, because testing is already happening.
Yeah, boy, it's funny.
Thank you. My next question, as you all are aware, actually this time we were prepared for the situation we find ourselves in now, with close to 900 or possibly more.
Well, that's it for today.
My question for
One
the
lockdown, 4 weeks starting tomorrow.
What is the capacity for COVID cases in the hospital?
Until next time,
capacity for
check out my videos, like and subscribe, read my books. You see what's going on in Bermuda. Other than that, ain't the destination place right now, unless you want to just be locked in a hotel looking out the
the chief of
window.
staff of the hospital
But anyway,
answer that question.
till next time, make sure you like and subscribe. Check out my new playlist. And bang.